if you're worried about lows, that's a good thing, right? I mean, in fact, everybody should be wary and concerned about lows because we know potentially, I'm assuming we're talking about type 1 diabetes,
Yeah.
this can potentially be not just embarrassing and a hassle, but potentially very dangerous,
hmm
right? So
hmm
it's kind of good that people can be wary and concerned. And by the way, we see lots of patients here in our own facility who don't have any fear of lows, which is actually a whole other kind of problem we could talk about. And I'm
Yeah.
sure you guys see some of those
Yeah.
folks as well.
And we have people swinging the other direction too, where, yeah.
So a little fear is kind of okay. It's
Yeah.
really when it gets in the way of your life and it makes you miserable and it makes you more anxious, or it makes you live with your blood sugars too high all the time and
Yeah.
makes you lead to cutting back on your, especially your bolus insulin, or it leads to you limiting your life, right? Saying,
Right.
well, a whole bunch of things I can't do. So those are the things we really get concerned. So I like to think of it as not as just fear of hypoglycemia, but as really pronounced fear of hypoglycemia.
Welcome to Think Like a Pancreas, the podcast, where our goal is to keep you informed, inspired, and a little entertained on all things diabetes. The information contained in this program is based on the experience and opinions of the Integrated Diabetes Services clinical team. Please discuss any changes to your treatment plan with your personal healthcare provider before implementing.
Hi, everybody. Thank you so much for joining Think Like a Pancreas, the podcast. My name is Anna Sabino. I'm the mental health clinician here at IDS, working with patients and families. And it is my pleasure to have Bill Polonsky here, just waking up from San Diego. Bill, would you just like to introduce yourself? Tell us a little bit about you, and then we're going to jump into fear of lows, everybody's favorite topic.
My pleasure. So again, you heard my name. It's Bill Polonsky. I'm here in sunny San Diego drinking my morning coffee. And I'm also a mental health clinician. I'm a diabetes psychologist. It's all I've done for 35 years and more and counting. I'm here on the faculty of the University of California at San Diego in the Department of Medicine. But more importantly, I run and co-founded and started a nonprofit called the Behavioral Diabetes Institute. And I spend every waking day worrying about the emotional, psychological issues in diabetes, both as a clinician and a researcher. So that's me.
Amazing. And if you don't know Bill, he's been around the block. He's one of the most esteemed psychologists out there, developed a whole lot of scales, tools, certainly one of my mentors in the field, read a whole bunch of research articles by Bill. So he is someone you should know if you don't know in the field of diabetes and psychology. I should have said too, I'm also a social worker, but diabetes educator, and lived with type 1 for, I don't know, 37 years now, I think, in counting. And the fear of lows. And I think one thing we want to normalize is just how much fear and anxiety come with just having diabetes as a diagnosis. As someone in practice, Bill, myself included, any, clinicians listening, can we just talk about what it means to be diagnosed with diabetes and almost this like simultaneous like background diagnosis of anxiety that goes along with it?
Sure. Well, again, someone who's living every day with it, you'll know more than I do, but we know that for anybody who's diagnosed with diabetes, the day you learn you have diabetes, it means the universe has just given you an extra job to do. Congratulations. There's no pay. There's no vacations. You get to
Yep.
do it probably forever. It requires vigilance. It requires a willingness and an ability to deal with chaos, right? Because we guaranteed crazy, wacky things happen all the time, despite our awesome technology. So it's as with anybody, if they didn't have diabetes, if you're busy enough and you give someone a new job that can be completely overwhelming, it gets overwhelming, right? Completely overwhelming. And you add on, the features of significant anxiety that can lead to pronounced fear of hypoglycemia. Of course, that just magnifies things.
Absolutely. And I think speaking from putting on my personal hat, there isn't a day that goes by where diabetes isn't immediately followed by the what if thought. And even just this morning, I have a black lab and I saw like a 92 with a slant arrow down on my CGM. And I like to do like a 2-mile walk in the morning. And I'm like, well, here goes nothing. And I grabbed a couple of glow gummies and put some in my fanny pack, and off I went. And somehow I leveled out, but it's always there. And, when we have type 1 diabetes, how is it ever not there? And I think something that I want us to kind of surface too is that how do we normalize anxiety? Because I think there's so much conversation around this fear of low blood sugar,
Yeah.
despite having all of this technology at our fingertips. Because I also grew up in the 90s where you really just had to listen to your own intuition and say, I feel low, and either treat
Right.
or check and move on. So for those brand new, diagnosed with type 1 or even type 2, how do we normalize some of this anxiety to just kind of like lower the threshold of fear ever so slightly?
Yeah. I'm a little concerned about your word normalizing. Like, I don't
Well,
want to
okay,
normalize it.
okay.
I want to make it better. I want to
Make
help
it
people.
better. Yeah, 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 yeah.
Well, let's do a little level setting. First of all,
Yeah.
if you're worried about lows, that's a good thing, right? I mean, in fact, everybody should be wary and concerned about lows because we know potentially, I'm assuming we're talking about type 1 diabetes,
Yeah.
this can potentially be not just embarrassing and a hassle, but potentially very dangerous,
Mhm.
right? So
Mhm.
it's kind of good that people can be wary and concerned. And by the way, we see lots of patients here in our own facility who don't have any fear of lows, which is actually a whole other kind of problem we could talk about. And I'm
Yeah.
sure you guys see some of those
Yeah.
folks as well.
We have people swinging the other direction too, where, yeah.
So a little fear is kind of okay. It's
Yeah.
really when it gets in the way of your life and it makes you miserable and it makes you more anxious, or it makes you live with your blood sugars too high all the time and
Yeah.
makes you lead to cutting back on especially your bolus insulin, or it leads to you limiting your life, right? Saying,
Right.
well, a whole bunch of things I can't do. So those are the things when we really get concerned. So I like to think of it as not as just fear of hypoglycemia, but as really pronounced fear of hypoglycemia
Mm,
where it really gets in the way. And we don't really know how common that is. I mean, I can tell you across studies, the estimates range from 15% of people with type 1 to 48% of people with type 1
yeah.
who really have pronounced fear of hypoglycemia, where it's getting in the way of your life. So
Yeah.
I'm hoping that's what we're going to focus on because those are the people we're most concerned about. Does that make sense to you?
Absolutely. Absolutely. And getting into that a little bit, let's just do it. How do you know when someone comes to your office if they are like just regular old afraid, or they have this pure pronounced fear? How is that presented to you in clinic?
We could give them questionnaires, but I don't really think you need them. I mean, to me, it's very straightforward. It's like, how concerned are you about lows and how is it getting in the way of your life?
Yeah.
You know? And if someone says, oh, I'm a little afraid of lows, they're not really getting in the way of my life. And my A1Cs are pretty consistently in the 9% range. I'm going to go,
Mm,
maybe getting in your way. Let's talk about this a little more.
yeah.
So, but it's looking at things, it's just asking people, but also if they've spent a considerable period of time where their time in range is really low or their A1C is really high, I'm going to be pushing in about that a lot and inquiring about that because that
Yeah.
could be one of a number of factors that may be contributing to that. And we know what that happens, right? I mean, the most common thing is what people do with mealtime insulin. Like when people
Yes.
say, "Oh, I would never take any insulin before a meal." Are you crazy? Especially not 20 minutes before a meal, not even before a meal at all. Maybe
Right.
during, maybe after, and even that amount, I'm gonna maybe cut it down a little bit. Or
Yeah, 100%. And I think though when we talk about sort of the cycle of fear, in my experience, it's like these safety behaviors that we are constantly stuck on that are keeping at least a lot of my patients away from exposing themselves to some of this more discomfort that maybe they're not necessarily used to, like over treating a low, or treating a low, or treating the arrow of a low a little bit too early. I think the problem is that we're compensating a little bit for that fear without giving people a chance to really address it. I don't know if you want to talk about that a little bit, or
Huh.
if there are certain like safety behaviors that you see as we talk about the cycle that you feel like are most prevalent, and how do we address that?
Sure. Oh, you triggered so many things for me. I'm trying to
I'm
figure out where to
sorry,
start.
sorry. We got time.
It's good though. It's all good. First of all, we should be clear how fear of hypoglycemia is different from other kinds of pronounced fears in people's lives. we're talking about something that's very real. I mean, the
Yeah.
danger of especially severe hypoglycemia is dangerous, right? And that's
Yeah.
different from someone who comes in your office and says, "Oh, I'm really scared of spiders," right? Or snakes
Yes.
or sharks. But hypoglycemia is very real. So we have to be respectful of people's concerns. We have to be understanding of how it is that people become very fearful of lows. And let me just introduce that. It's become of surprise to me and interest when I finally realized that a lot of people, probably the majority, and this is from our very first study a long time ago, who are at risk of fear of hypoglycemia, or again, I have to be careful about saying pronounced fear of hypoglycemia, do have some history of anxiety already, and or there's some family history of anxiety. And what that suggests is there really is a potentially genetic biological elevation that takes place so that you're a little closer to be likely to develop this pronounced fear of hypoglycemia. And I remember when I first person I saw and I realized that, who was really terrified about lows and was really, really interfering with her life. And she began to tell me, "Oh yeah, by the way, I'd never get on an airplane because it could crash." And oh, by
Mm,
the way, and had all these other significant fears in her life. And this was just one more that had become even bigger, probably the
yeah.
biggest. So we see that a fair amount. So there's that probably genetic risk that
Yeah.
already is there. And we also know a lot of these folks, not everybody, has had at least one severe episode in the past. And that could have been a long time ago, right? So I remember one gal who had a very severe low when she was at a swimming meet, I think when she was in high school, and had it in the pool. And it was just a terrible experience for her. She was fine, but that was, what, 25 years ago? She's never even had a low since then. But that's enough.
Yeah.
Think of it as a post-traumatic
Absolutely.
post-traumatic event,
Yep.
leading to sort of a fear of hypoglycemia, PTSD, that was
Yep.
really messing up her life. So those are the kind of things that we know that can trigger it that we have to also pay attention to and look for as well. You probably see that as well.
I see that. I see that a lot. Whether it is, I know we're talking about fear of lows, but whether it's a, repeat DKA admission or it is
Mhm.
a, severe low event, that one trauma can, trigger a lot of these sort of increase in safety defense mechanisms, whatever you want to call them, to try to, avoid said experience happening again. And I think you're 100% on the money when it comes to this. I don't want to say predisposition of genetic makeup, but once, I get in the weeds with a client, it's like, oh, my mom also has anxiety. Oh, I also live with ADHD. Okay, keep it coming.
Right.
And you're peeling off the layers of, okay, if this is your personality at baseline, diabetes is going to blend in a way that might be different than somebody else.
Right. I hate to call it personality, but you're at
I
some
know,
extra
I know.
biological risk, I would say.
Biological
But
risk.
the other thing to consider at base, what pronounced fear is all about, and I think this helps us to think about what we can do and how we help folks, is that at base, this fear is really about people losing confidence in their bodies.
Yeah.
I feel like I just can't trust my body to do anything. I can't go to the grocery store. I can't drive a car. Who knows what the heck it's going to do next, right? And when
Right.
you lose confidence in your body, that's where you really begin to see this impacting people's quality of life, impacting their ability and
Mhm.
willingness to take new risks, and can also lead to, of course, significant problems with glucose management over the course of time. But so our biggest goal is really about how do we help people regain confidence in their body. I can trust my body to take me around. Now, you brought up something interesting that I'm only recently beginning to think about, which isn't just losing confidence in one's body. It's also losing confidence in one's tools. Like,
Yeah.
I don't really trust that CGM number. And I notice it's acting funky again. And can I really trust this pump is really working and what's it really doing? So all these things are kind of adding on to this loss of confidence in one's body and making it, I think, even more complex for folks.
Yeah, I see much more of the latter in the families that I work with. I work with primarily parents and young adults where they are often given a CGM at discharge. And so they're immediately brought into this world of potentially information overload
Hmm. Yeah.
where they're forced to need to understand, what is this telling me my body should do with this information? And sometimes may not necessarily give them a chance to kind of trust and learn. So to kind of piggy on that, how do you think all of this, technology over the last, I think, 10 years, in 2014, no, 2012, I think I got a G4. And I had sensors before that, and they were dicey. But I also had this sort of baseline sense of resilience where I didn't, for 15 years, I didn't have technology, and it was 45 seconds of a giant drop of blood. And I had to really get into my symptoms. And the only thing I had was to trust my own intuition, symptomatology, and then rely on a blood glucose meter.
Right.
And so how has technology shifted the way we have fear around our blood sugars? Because I see this all the time.
Yeah.
Patients aren't trusting their systems. And I'm just like, okay, hold on a minute. Is it around education? Is it around the technology? Why haven't we trusted the symptoms? And I think a lot of the times it just comes down to the discrepancy of a past historic event, like you mentioned.
Before we talk about technology, you mentioned something I just want to highlight because you work a lot with families.
Mm-hmm.
It's important to know all of our research evidence shows us if there's one group that has become more fearful of hypoglycemia than any other, it's parents.
But yeah.
And in terms of insomnia, in terms of all the other things, breaks my heart, right? And those are the people we're
It's
probably most
heartbreaking. And
concerned
we
about.
have these tools.
Yeah. Yeah.
Yeah.
So technology, I don't have to tell you this, has been a really interesting double-edged sword. So, my favorite article I wrote just a couple of years ago was about, so what do we do about fear of hypoglycemia? And to me, the first step, probably the most important thing we ever can do to help people deal with fear of hypoglycemia is get them a CGM, right? I mean, there's just no question how much the evidence is very good, has really helped to alleviate fear of hypoglycemia. But as you've said about your own experience, at the same time, those trend arrows have made people very nervous. A lot of people very, very nervous.
Yes.
So it's really been this double-edged sword. But again, even those trend arrows is really about, at heart, still about confidence in your body, right? It's like, okay, I'm heading down. How far down am I headed? At what point do I have to do something? So it's giving us potentially extra valuable information that sometimes works against us. But I really want to talk about what to do about it. Can we do that?
Yes, let's do it.
I will just tell you with my research hat on for a moment, it has been bizarre that even though we, broadly speaking, have been writing about and researching fear of hypoglycemia for almost 40 years. And there's been so much written about this. Remarkably, there has been almost nothing written about what to do about it. It's really about how common is this? Gee, I wonder where it comes from. I wonder what's going on. But there's been very, very little written about what to do about it, especially in this age of technology. So, and it kind of just hit me in the head a couple of years ago. And I went, what the heck? So I sat down with my colleagues and we wrote, again, one of my favorite articles about what do we really know about what to do? And we realized, again, from our own practices and again, from what the research evidence shows us, that the most important thing we wanted to communicate to other healthcare providers is that there's really two groups of strategies we needed to be clear about. And those two groups are important because sometimes you need both. And if you just do one and realize nothing's not working, it's probably because you haven't done the other. And so one group of strategies we call the be safe strategies, and the other group we call feel safe strategies. And I think it'll be pretty obvious to you, but the first group really has to do with what do we do so that we're actually reducing people's risk of having severe episodes. Pretty obviously, right?
Yeah.
We want to make sure they're, maximizing their insulin or medication regimen so that the risk is lower, which is often profoundly helpful, right?
Mm-hmm.
We think about hybrid closed-loop systems. We think about Afrezza. I mean, there's so many things that can really help and make a huge difference.
Absolutely.
We think about, again, the importance of making sure people have CGM. We think about the importance of when people have impaired awareness and how we can begin to reverse that for people so that you can begin to feel earlier symptoms of lows. So there's tons we can do. And we can't really help people feel safe without dealing with being safe. But what's important is even if you help people be safe, so make it very, very unlikely they're going to run into severe lows, that's often not enough. because they've
Right.
been traumatized or they have
Yep.
this high level of
You can
anxiety
have
already.
all the glucose tabs in your glove compartment and all the tools set up, but
Exactly. Yeah.
is the answer there.
Uh,
How do you sit in that discomfort of that feeling and
right.
that feels safe? So I
Right.
can't wait to hear about what these feel safe techniques are.
Well, we basically sat down and thought about it. We said, "Look, there's really 4 feel safe strategies. And one of them, just to be redundant, was to get people to CGM.
Yep.
Again, we have good evidence that having that available information really does help people to feel safer and parents as well.
Yeah. I mean, I'm one of those people now that even though I was diagnosed in '89, like, so at least 20 years
Uh-huh.
without, maybe 5 years without a CGM, I
Yeah.
am one of those people now that's like, "Oh, I I don't like going to bed without it." And I'm very lucky that I have the access to the technology, but it is a safety measure for me, even though I 9 times out of 10, I will wake up in range and, without a severe low. I have had 2 severe lows, and they were overnight. Granted, this was in the days of Ultra Lente and Lente,
Yeah. Yeah.
but it is a real safety,
Yeah. I mean,
piece of
it's
assurance.
nice to know someone's got
Get
your
it.
back, right?
Yeah,
And even if that thing or that person has got your back, sometimes gets a little wonky. But the bottom line is you got someone's got your back.
yeah,
So doesn't solve it for everybody, but it's a huge important first step. The Probably the best evidence for that than almost anything else we have. So, and what's remarkable, I still find this amazing, is a very high percentage of people with type 1 diabetes in America who don't have CGM. I mean, it's 2026. How's that even possible?
I
I mean,
know.
it's really unfortunate. So that's, number one. Now, the big one, the one we think is the most obvious one, of course, is, what we used to call exposure therapy, right? Or systematic desensitization, which sometimes we rely on a little too much, but at the end of the day, it is the most important thing. It's probably the second most important thing, which is basically you build confidence by helping people take small risks, right? Well, what happens if you took 1 unit of insulin before your next meal? What do you think will happen? Let's do it together and watch what happens. Let's see if you die. Let's see if you
Yep,
end up with a severe low. And so you sort of take it very respectfully, very slowly. I'm thinking of
yep.
folks I've met I remember a guy he no longer felt safe riding his bike and he loved riding his bike.
Mm,
And so we set up this little plan for him. So the very first day, and this is someone who used to do long distance rides, was to get on his bike and to go around the block, just ride around the block where he lived. Took like 3 minutes, and just
yep,
do that every day for a week. He thought it was really stupid, but he was agreed to do it. And then it was
yep,
2 blocks. Then it was 3 blocks.
yeah.
And he went, and slowly but surely went, okay, yeah, I can do this. And again, sort of this regular exposure therapy, if people are willing to do that, is probably the most effective way we can help people again regain confidence in their body to know that they're going to be pretty safe.
I couldn't agree more. I work with, obviously, like a lot of parents. One parent in particular, this is a different approach, but she didn't feel safe with. She would start taking action with a blood sugar of 150. Her son was 5 in kindergarten, and she would sit in the parking lot for child's school. And anytime, they had every plan in place, the
Yeah,
glucose, the sugar mate, all the things. And she would go in the school every time she saw a blood sugar under 150. And
oh,
we slowly kind of desensitized her. Let's try 140. Let's
yeah,
try 120.
yeah,
And every 2 weeks we did a lot of breath work and a lot of other things, but you got to start somewhere. And it is hard. It's heartbreaking, but it works.
yeah. And that's usually the final thing we have to do, but it's really where we want to focus our attention, and it is what helps people to do well. I will mention we've had more complex cases where there's other things we
Mm,
need. It has to do with sort of has to do with this impaired awareness issue. So we
yeah.
often have to spend time. Again, I'm dealing with usually adults, so this doesn't really
Mhm.
make sense for parents,
Yeah.
but with symptom discrimination. So as you know, one of the sneaky, really awful things about how fear of hypoglycemia comes about is that the hormonal response to going low, the pattern of hormones that are released is pretty much the same that happens when you get scared, right? You have this
Yes.
adrenal response, you have this cortisol response. So if we think of the common, adrenergic responses to being low, where you can feel a little shaky,
Yeah.
sweaty, heart
Heart
palpitation.
racing.
That's what you can feel when you get scared. And so those get confused, right?
Mm.
So I'm thinking of people I've worked with, over the years who will say, uh-oh, I'm having a little trouble breathing, right? I can feel some pressure in my chest or my heart's beating. I must be going low. Or am I just getting scared that I might be going low? And so helping people take that apart can
Yeah.
also help be reassuring. It's also helpful when you can look at your CGM and say, well, wait a minute, what I'm feeling doesn't make sense according to this CGM if I trust that. So
Right.
that that can get a bit elaborate, but the sort of symptom discrimination effort sometimes can help quite a bit as well. By the way, one other thing about the exposure therapy concept that I will add, and this is something that my colleague Susan Guzman really taught me,
Mm.
is how valuable it can be to sit with folks and let them see how well their rescue medications work. I mean, literally sit there with you. Go, okay, well, what do you typically do? Well, I'm going to have, a couple glucose tabs. Okay, well, let's see if it works, So let's sit here, take a couple, let's stare at your CGM together and see if it actually brings you up. And that can often be reassuring as well to help people see that this stuff does something,
I
because
love
again,
that you
it's
said that. I love that you said that because again, like chiming in with, I know I'm an N of one here, but back in the day, I would be in the nurse's office, middle school, and I would have to sit there. I would sit there for 15 minutes and, right around the 7, 8 minute mark of after a juice box or my
yeah,
favorite vanilla frosting, I would, it would be something that would click and be like, I feel better. And she
yeah,
would say, okay, why don't you recheck? And I would be, 87 or as long as I was, 20 or 30 points higher than I was. But I had to sit there while everyone else was taking their lunchtime meds. I'm just sitting there.
yeah,
And it was this forced ability to really learn to trust that this glucose is working in my body. And I think that has really helped me realize that like I, I'm not really afraid of because I
yeah,
know that sugar just doesn't not work for the most
yeah,
part. And I think that has really, really helped me not over treat my sort of lows and trends. But it's really, really hard when you have a kid who's maybe 3 and can't communicate. I
yeah,
feel better,
right,
or someone who's older and is very confused by the different symptoms they're experiencing.
yeah. I'm thinking about the work you do with families. So I want to add one other thing. So if we think about people with pronounced fear of hypoglycemia, in many ways we have two different groups of people. We
Yeah.
have one group that's become so fearful they may never have lows, so they're just sitting up there in the 200s and 300s all the time. But we have another group that might be bouncing up and down a lot, who are still having a lot of lows, but are still terrified of them.
Mm,
And one of the things that we have found, and it's so obvious, that's been incredibly valuable, which is making sure people have a number that they agree to. If they see that number, they're going to take action. And it is amazing how few people actually have that.
hmm.
Like if you say, okay, what number would you stop what you're doing and take action to treat a low? And I can tell you the thing I worry about the most is when someone says, well, it depends. And I go, what do you mean it depends? Well, if I see it's, 60, but 8 recently, and I'm driving home, but I'm almost home, and, the insulin on board, it's not that high. And I go, wait a minute, wait a minute, wait a minute. So you might be low enough so that you're having neuroglycopenic symptoms. You may not be thinking clearly, but you're walking through this complex cognitive algorithm to make a decision about what your best action could be at that point.
Yikes.
Can you see how that might get you into trouble? And
Yeah.
people really struggle with that. But
Yeah.
if you can get some agreement that, no, when I see X, and for a lot of our patients who really are at risk, we might say, if it gets to 80, if it even gets to 100, or underneath that, this is when you want to stop what you're doing and take action. And if you can get people just to experiment with it and do that for a week or two, they can begin to see it doesn't mess up their time in range or their A1C. It actually helps to improve it and helps to flatten things out a bit
Yeah.
because they're not over responding when they're super low, et
Right.
cetera. So just to mention that, I think that's maybe even more important for parents, like you did with that
Yeah.
mom sitting in the parking lot. You
Yep.
don't want treatment at 150, but
No.
some agreement that this is a number at which you take action. And of
Right.
course, we're really talking about nowadays number trend line combinations.
Yeah. Yeah.
Think Like a Pancreas, the podcast, is brought to you by Integrated Diabetes Services, where experience meets expertise, passion meets compassion, and diabetes care is personal because we live it too. Our team of clinicians, all living with type 1 diabetes, understands the challenges firsthand. We're here to help no matter where you are in the world. From glucose management to self-care strategies, the latest tech, sports and exercise, weight loss, type 1 pregnancy, and emotional well-being, we've got you covered. We offer consultations in English and Spanish via phone, video chat, email, and text. Want to learn more? Visit integrateddiabetes.com or email info@integrateddiabetes.com to schedule a consultation.
100%. And I think it has to be shared, and it has to be really driven by the client, the patient, or else the likelihood of it happening isn't super high. One thing I did want to mention was, how we don't have a ton of information on this, or I haven't seen it on really, this idea of just knowing the facts of the probability versus the possibility of a severe low actually happening. I go back and forth on this because some people are like, well, the likelihood of it happening is so low, and should you carry glucagon with you? And that's what I hear from adults and kids is, what is the likelihood of this actually happening, justifying in their head? But do we actually know those statistics? Because it's really hard to know unless we uploaded every single person's data,
Yeah.
got claims data, all the things, right?
Yeah.
How do we know that? And is that a, solid way of communicating any type of sort of hope and confidence into these fearful people?
I think it can help a little bit, especially for parents, but not
Yeah.
very much.
Yeah.
And for people who are scared of sharks, I could spend all day telling you how low your risk is of actually getting killed and eaten by a shark. But it could happen, right? So, and it's the same thing when it comes to hypoglycemia. I mean,
Yeah.
we could talk about the risk, how few people actually, die actually because of severe hypos. Still
Yeah.
happens though, right?
It
And
does.
so it's for an individual and especially for a parent who cares, the fact that it could ever happen is what's so scary, right?
Yeah.
So
Yeah.
I don't find that sharing risk information is that helpful. I wish it was, but I
Yeah.
haven't found it that helpful. Have you?
Yeah, not really. I think the people that I talk to like to know, like that knowledge often helps them
Yeah.
being able to, categorize, okay, the likelihood of it happening, but it doesn't change the way they feel about it, like you
Yeah.
said.
Yeah. We know that even though with hybrid closed loop system things are changing, last I saw, we know if you have type 1 diabetes, even in the year 2026, on average, people are having about one severe episode every year, if not more.
Mm.
So it's
So to that point, how do you define a severe low? Just for all the listeners,
good
because I
point.
think everybody will define a severe low in their own kind of relative way. But I would love for you to share that as a psychologist.
Sure. Well, the nomenclature is officially changing all the time,
I
but
know.
in general, the way we think about severe lows is you're so low, you need help from somebody else
Yeah.
to get out of it.
Yep.
So that's still a decent definition. So if you're so low that you need help from somebody else, that's kind of it.
Yeah.
In
And
truth,
here's
I
that
see lots of
most
people
people.
who get extraordinarily low, never get help from anybody else, and manage to recover. And I'd still think of that as quite severe. So we
Yeah.
can think about, of course, numbers, right? So if you're under 55 milligrams per deciliter, on your you have lucky enough to have a CGM. We're talking about the very low number at the bottom that we try to keep to less than 1%. But so actually anything under 55 is of great concern, is a very significant concern, but especially if you need help from others.
Yeah. Yep. No, 100% agree. And that's usually how it's written in most, I
Yep.
think, still, assessments and feedback forms. As we start to wrap up a little bit, if there are like 2 or 3 kind of key takeaways for anyone who's using insulin, whether it's a parent, whether it's an adult, what would you say would be kind of like top 3 things? And I can chime in too.
Top 3 things for
Helping to break your own cycle of fear.
number 1, you should have a CGM. You should have a continuous glucose monitor today. Even if you're so cool you don't want to wear something all the time, you should have a CGM. Get to it.
Yep.
There's no question about that.
Yeah. Number 1,
It
safety. feature.
If you're living with severe fear, odds are pretty good you're not going to be able to figure this out by yourself. And they need someone like you who could or me, who could really help them. Because at the end of the day, it's things like these sort of modified versions of exposure therapy, helping people regain confidence in their body. That's really key. And it's really hard to do by yourself.
Yeah.
Really hard. So that's probably the other most important thing. And again, that can involve taking risks of being more active. It could be taking risks in how and when and how much insulin you take. You should absolutely always be carrying around rescue glucagon with you, or someone with you should always be carrying around rescue glucagon. I mean, again, it's not these big kits anymore, right? It's these little
Yep.
tiny things. It's
Little
no big
box.
deal.
Yep.
Just have
Yep.
them.
Yep.
But remember, it's really about regaining confidence in your body. And if you're running into trouble with lots and lots of lows or wacky blood sugars, again, it's not your fault. Odds are pretty good you need to talk to a great endocrinologist, diabetes educator who can help you change your insulin regimen so that you don't have to be going up and down all the time. Oftentimes,
Yeah.
it's that sort of roller coaster wackiness that's making
Yep.
all these things difficult, giving you these crazy trend lines up, down, and sideways that are driving you nuts as well.
Yeah.
So you
I
you
we
do
find
those
that
2.
all the time. It's like part of the problem is the fear is rooted in this just lack of education and understanding in
Yeah.
what's actually going on in my body, and having someone to just sit down and explain some of what the, squiggly lines mean.
Yeah, it's not you, man. I mean,
Yeah.
this
It's
diabetes sucks.
diabetes. Always blame diabetes.
Yeah,
Diabetes
yeah,
stinks, and it's okay to say that.
absolutely.
Where would you point people in turn? I mean, I know therapy is mindfulness, all the, mindfulness is going to help, but really, like you said, it's a little bit of CBT, it's a little bit of exposure, desensitization, whatever you want to call it. How do you point people in the direction of like the best resources? I mean, obviously everyone should come to IDS, but where do you tell people to go to find someone who will really get to the root challenge of their fear, or what other resources do you point people towards if they're struggling?
Well, I wish I had a good answer for that one.
I know. Me
We've
too.
been trying to build an online resource for fear of hypoglycemia
Oh,
for years, and we've actually never been able to get funding, but we're still trying. And the problem is that most mental health professionals just don't know about this stuff. So I guess I would say 2 things. One is, while it's not perfect, you know about and we all know about the ADA's mental health
yeah.
registry. So
Yep.
you can go to diabetes.org, just Google or just put in
Yep.
mental health registry, and you can see by zip code where there are mental health professionals like you, like me, who
Yep.
supposedly know a fair amount about diabetes. So that'd be a place to start. If there's not a
Yeah.
ton of people like that though. If that's too
No.
difficult, finding someone who's knowledgeable about dealing with phobias, dealing with anxiety disorders, knows about
Yeah.
exposure therapy, and with the understanding that you are going to probably have to teach them about diabetes. You know,
Yeah.
and that's at
Yeah.
least a place to begin. And I think that can also be very helpful as well. I wish there were more people like you and me,
I
but there
know.
aren't.
I do too. I often tell people, you could try something like psychology today, but make sure you ask, like you said, these pointed questions.
Yeah.
Have
Yeah.
you worked with people with chronic illness before or PTSD? Have you used this type of model? And be willing to, self advocate and build your skills around asking for what you want and not getting no for an answer. And I think that's the
No.
hard part with therapy, is that you have to jive with the person and build that sense of trust, and that becomes overwhelming and it's hard. And
Yeah.
there's also, something to be said about peer support. One thing about the diabetes community, I know you know this well, is that there might not be a ton of us wandering around the streets, but there's enough of us,
Mhm.
and most 99% of people are willing to listen and connect with somebody else who just
Yep.
the unspoken understanding. I see the CGM on your arm, you get it. And that's oftentimes what matters the most.
Yeah. Nice to know that someone gets it.
Yeah.
Speaking of which, let me add something else that I think is important as we think about how
Yeah.
want to help people to be safe from hypoglycemia. I don't think you have to worry about this as much with parents, but we do with
Mhm.
adults. What's amazing to me is we have, like, for those folks who are using Dexcom, we have share, right? So that
Yeah.
we have share follow, so that you can permit other people to see either your glucose data right now, or at least be alerted if you go low. And what is really remarkable is how few adults with type 1 diabetes share with anybody.
I don't share it with anyone. I
And but
should.
and I imagine the reason the same is for you as for anyone else, especially if you've gone through years of being shamed and blamed for your blood sugars. There is this tendency to say, I'm keeping this private. This is mine, not
Yeah.
yours. And the last thing I need is anybody saying, well, why? What happened? Why'd you go low? Why'd you go high? What'd you do wrong this time? That there's so much concern about that, understandably, that people
Mm,
just say, nope, no need for anyone else to see my data. And yet we know that's one powerful thing that can help you to stay safe if you set up the parameters with whoever you're sharing with.
yeah.
We tried to,
I think that's a whole other conversation. But I
yeah,
think, for me, and I know a lot of others, like, I don't want to be a burden.
right,
My husband last night was even like, your pump. I'm like, it's just a low battery, it's fine, or low reservoir, like it's fine. Like I have 18 units left. I'll be fine till the
yeah,
morning. I don't like changing it right before bed, blah, blah, blah. And he followed me when I was pregnant and I was having some lows, first
yeah,
trimester, whatever. And he was just like, do you still need me to follow you? This was pandemic. So we were literally both home all the time.
right.
And he just stopped. And I was like, it's fine. But now I don't know. I wish more people would ask me more questions and have a little bit more insight into my, mental day to day. But at the same time, again, this could be a whole other podcast. It's a catch
Oh,
22. We want people to be concerned when it needs to be, but at the same
exactly.
time, feel like we're invincible, also living with diabetes. And that's the hardest part
Well, it'd
is,
be nice to know someone has your back, but
yeah,
don't be in my face.
yeah,
And
yeah.
that's especially valuable, and I'm sure this has been true for you, is there is this extremely funny phenomenon that for folks with diabetes with wearing CGM, the majority of them sleep through their alarms, but
Yeah.
not their partners. And
100%. Yep.
yeah, so, you know, we should do something about that. Anyway,
Yeah.
you're right, whole other conversation, but relevant to this issue about hypoglycemia concern.
Relevant to the issue, and I bet if you polled people, yeah, you're right. A lot of people don't want to share, they feel like they're a burden or, maybe in times of, extreme, like, travel or sickness or whatnot, they'll invite people in, but nobody
Yeah,
wants the attention of "poor me" or
right.
"I'm a burden," and lows are scary. Nobody wants to feel like they're a burden on somebody else, and again, it comes back to what you said around the safety issue, and that, this is a safety issue. I deal with this a lot when the 18-year-old is suddenly cutting off the parent when they're going off to college, blah, 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 and it becomes a safety issue. So, is
I
there
agree.
any kind of last parting words, Bill, that you wanna kind of share with people around fear of lows and staying
I
in
would
the
just say
game?
if you have pronounced fear of hypoglycemia, you're not a weak person, you're not a bad person, you didn't do anything wrong. This is the nature of living with type 1 diabetes and all these other stuff. It's easy to lose confidence in your body because of this. And the good news is, as we've talked about, there's a lot of things you can do to regain your confidence and have your life back
Yeah,
and to be able to manage diabetes successfully. So don't give up, have hope,
love that. Love that. All right, everybody. Thanks for joining, and we're gonna sign off.
Thanks, guys. Thanks for being here.
Thanks for tuning in to Think Like a Pancreas, the podcast. If you enjoyed today's episode, don't forget to like, follow, or subscribe on your favorite podcast app. On behalf of Think Like a Pancreas, the podcast, I'm Gary Shiner, wishing you a fantastic week ahead. And don't forget to think like a pancreas.